I'm not feeling well. My health is withering away. My sunny days got overcasted, now my casket is gray. I'm not feeling well. My hepatitis C AIDS, after HIV AIDS, the path that laid me in the early grave. I'm not feeling well. My health is counting on my cells. But my cells are like behind cells, disease jails. And as a black male, sometimes I feel blackmailed to trail behind in despair. Low income, no health care. I'm not feeling well, and I'm dying in a drought. No water in my well, got an empty bank account. And a high viral load with a low CD4 count. Below 200, I'm biologically hunted. Blood pressure climbing, strokes on the horizon. Blood vessels clogging, my brain is getting no oxygen. Air supplies depleted, my spirit's feeling defeated. Felt by a country we all pledge our allegiance. Satan's venom secreted in the veins from the fangs of a demon, biting, then binding in the bloodstream and semen. Infectious, contagious, and sex drive outrageous. Translates to an epidemic like Indiana's new AIDS cases. Pardon me, I meant HIV. I stand corrected medically, but psychometaphorically, yeah, I could bring it scholarly, but I'ma bring it to your chest. It's no conspiracy that blacks lead the pack and cause of death. Heart disease. I believe that the leading cause is stress and depression, which then leads to other things like diabetes, overeating, and obesity, overstretching the flesh. John Henry was a black who slaved himself until his last breath. And blacks have prolonged exposure to stress. Due to structural racism, our bodies are perplexed. Racial health disparities equates to race-based inequity. First, from the rate of infant mortality to the fact that blacks are last in any wealth capacity. And many pseudoscientists, they say the cause is ethnicity. But in reality, who's engineering that philosophy? I'm not feeling well, and ditto says my sick society. That's why we lack camaraderie. We're troubled with disharmony. Post-traumatic slave blood clotting in our arteries. A massive heart attack. It's like a straw that broke the camel's back. A human being issue. And you can't deny the facts. If you black, say it with me. I'm not feeling well. You understand? Say it with me. I'm not feeling well. You overstand? Scream it with me. I'm not feeling well. You understand? Whisper with me. I'm not feeling well. This is an African American state of emergency. And to understand this dynamic, one must have structural competency. The politics of race in the framework of medical knowledge has become covertly toxic for those with various shades of chocolate. From the overdiagnosis of schizophrenia afflicting African American men, to the unconstitutional criminalization of a health problem, i.e., substance use in childbearing African American women, blacks have been disproportionately victimized via medical apartheid. Harriet Washington investigated the inhumane treatment in the hands of white men on black lives. And how do we survive the complexities that reflect structural inequities, medical politics, legal codes, invisible discrimination, and socioeconomic disparities? It is time we theorize new innovative approaches to reconceptualize social and economic impact on our well-being. Because what I'm seeing is a psycholinguistic coding hiding the underlying reasoning for this unethical treason. Black Lives Matter.